We are gearing up to begin our Excellus Blue Cross Blue Shield Medicare webinar in just a few seconds. Waiting for everyone to tune in and get ready for a wonderful hour of information and accessibility to find out more about your future. Hello, everyone. I'm Rebecca LeClaire, and I will be your moderator this evening. Welcome to the Guide to Medicare webinar. It is presented by Excellus Blue Cross Blue Shield. I am so excited to be here as a former TV journalist in the Rochester region. I love sharing information with the community, and I can't wait to introduce our guests in just a moment. But today we're going to be focusing on the basics of Medicare, how to get started, and why it's so important to review your coverage annually. We understand this is really a personal decision, and you may be making this for yourself or for your loved ones, and there is a lot to take in and try to comprehend. So over the next hour, we're going to hear from a team of local Medicare experts. You're seeing them on your screens right now, and they're going to help us guide us through what could seem at first like an overwhelming amount of information, but we're going to break it down for you and make it as simple as possible so you can understand. So let's introduce the team right now. We're going to start off with Elisa Brescia. She is a regional Medicare consultant with Excellus Blue Cross Blue Shield. Elisa is an expert in assisting people with their Medicare choices to find the coverage that's best for them. We also have Jane Ahrens, and she's an independent Medicare broker and founder of Ahrens Benefits Company. Jane specializes in Medicare 101 seminars and is helping a lot of people get started with their Medicare. So thanks for joining us, Elisa and Jane. And Dr. Ankit Garg is the Vice President of Medical Affairs for Medicare for Excellus Blue Cross Blue Shield. Dr. Garg oversees strategic planning and execution of Medicare Advantage for Excellus. So he knows these plans inside and out. He is a wealth of information, and we are honored to have you here with us tonight, Dr. Garg. So we do have a few pieces of housekeeping information to get out to you before we start our conversation. We are recording this session so you can refer to it as a reference, and it's going to be sent to you in a thank you email from the Buffalo News. And of course, we love your participation. You can add in your conversations and your questions tonight. Throughout the panel discussion, if you have a question, all you have to do is drop it into the chat session. And we do have an Excellus rep, Ryan, who's going to be answering questions for you in the chat throughout this program. And then at the end of the seminar, we're going to be providing contact information if you'd like to reach out to someone with a specific question to meet your needs. And that's after the program. So finally, at the end of this main discussion, we're going to give our panelists a chance to answer questions live. And that may appeal to the general audience, even though you're asking a specific question, but we will appreciate you asking those questions in the chat, and then we can answer them as best we can. So ask away, and let's get ready for this wonderful session. So let's get to it. Our first section is on Medicare basics. So we're going to start with Dr. Garg, and we hope that he can go through all of the parts that we're going to be talking about. But let's talk about what Medicare is. Let's start there.
Thank you, Rebecca, for a wonderful introduction, and good evening, everyone, who's listening to this. I understand, Medicare can be extremely overwhelming, especially all these different parts. So I'll start with just basic overview of Medicare, which is, just like your, insurance, Medicare is a type of insurance, which is administered by CMS, which is the Center for Medicare Services. And Part A is something which is completely free in a way that if you're eligible for Medicare, Part A is going to be something which is something that comes on. You don't have to have a premium for it. What does it cover? It covers hospital bills. It covers skilled nursing facility bills. It covers home health, which is, you know, when you are discharged from the hospital and you go home and you have services like physical therapy, occupational therapy, or home health aides coming to your house, those are covered. And eventually, like in the end, you know, there's hospice, which is covered by Part A. And like I said, you know, there's no premium for this. And compare that with Part B. Part B is something which you have to pay a premium. You know, usually it runs about, you know, $170. I think 2023 is actually the first year that the CMS Part B premium has actually gone down by a few dollars. But what does it get you? What Part B gets you is essentially like, you know, all your physician visits, your outpatient surgeries, your lab testing, your vaccines, any medications that you get while you're in the physician's office, or you know, those chemotherapy infusions, those medication infusions, if you have you know, one of those inflammatory conditions which require these infusions. So all that is covered in Part B. But again, like, you know, this is something that you have to pay a premium. In most cases, I think that premium is already deducted out of your Social Security, but you know, my colleagues can go into a little bit more detail of that. So those are the Part A and Part B. If we can go to the next slide. So Part C is, you know, Medicare Advantage plans, which is, you know, what all these commercials that you see, you know, the commercials by Aetna or AARP or United or Humana or, you know, even Excellus. So these are essentially, you know, the same thing as, you know, traditional Medicare, but the plan is administered by this company. And you know, I'll take an example. For example, us, you know, we are an insurance company. So if you buy a Part C plan from us, we work directly with CMS and administer this plan, if that makes sense. The last part, the Part D, this actually came on board very recently. This was passed as a law only in 2006. And what this covers is prescription drugs. And another important part about the Part D plan is, again, you have to pay a premium to be included into the prescription drug coverage. Now, an interesting fact about like Part D coverage is you know, you can, if you choose to be on traditional Medicare, you can buy the Part D prescription drug plans through, you know, any of these carriers and still keep your original Medicare. So that's an option. But the good part about Part C is most of the plans will combine the prescription drug coverage and the Part A and the Part B, everything together, and offer you a plan which is Part C.
All right, thank you, Dr. Garg. I know we're going to be talking more about the prescription coverage in just a bit, but let's go to Elisa, because let's talk about Medicare Advantage. And Elisa, what is not covered by original Medicare, and how is a Medicare Advantage plan different from the original Medicare plan?
Yes, so there are many extras that, you know, signing up for a Medicare Advantage plan will get you, such as dental, vision, hearing, even transportation on some plans, gym memberships even. All of those are what we call extras that original Medicare does not cover. Also, with original Medicare, there is no out-of-pocket protection. So if you join a Medicare Advantage plan with Excellus, we have out-of-pocket maximums. And once you reach that out-of-pocket maximum, that is your protection. And Excellus pays your bills in full for the rest of that year. So those are things that original Medicare does not offer. So these plans really help bridge the gaps that are missing in original Medicare. So those are great reasons why someone may want to consider looking at a Medicare Advantage plan.
So I know some of our viewers are already asking, what criteria should I use to determine if I should switch from regular Medicare to the Medicare Advantage plan? What criteria?
So it's always a really good idea to take a look at your Medicare Advantage plan every single year. Things change, benefits are added, benefits change. So it's always a really good idea to review your plan. Again, adding a Medicare Advantage plan just gives you more. So having just original Medicare isn't going to give you all the things that you deserve and that you could potentially need. So again, a Medicare Advantage plan is going to be the way to go because it will give you all the extras and you'll be fully compliant with what Medicare wants you to have.
All right, so let's bring Jane into this conversation because Jane, what are the other coverage options? Like what is a Medicare supplement plan and who would this work best for?
Okay, and I think there's a slide for supplement. I just want people to be able to see the slide. It's slide 4. I don't know what happened to the slides. Anyway, if you talk to seniors, every senior will tell you about their supplemental coverage. It's really important that people know there's a big difference between a supplement, and there really is a supplement, versus a Medicare Advantage plan. They are not the same thing. I call them day and night, cat and dog. So if you choose a supplement plan, Medicare stays as your first or primary insurance. The supplement is in the second position. The supplement cannot pay if Medicare doesn't pay first. So Elisa talked about there's no dental, vision, or hearing on original Medicare. So a supplement cannot pay for dental, vision, or hearing like a Medicare Advantage plan can. So if you choose a supplement, you have 2 cards that you show to every doctor, hospital, or facility you visit. Your Medicare card and your supplement card go together because they bill both as the primary and the secondary insurance. Plus, that person also has to buy a Part D to cover their prescription drugs. So that's called a standalone Part D. So they've got 3 cards in their wallets now, versus the Medicare Advantage plan, that person only carries 1 card, the card of the private insurance. They don't show their Medicare card when they're on a Medicare Advantage plan. So you've got 1 card versus 3 cards. So the big difference is with a supplement plan, all you have to do is see a doctor who accepts government Medicare, and that same doctor will accept the supplement. They like the supplement in that regard because they know Medicare is going to pay the bulk of their bill and the supplement's going to pick up some or all of the rest of the bill. So it works great for the person who travels the country all the time, never wants to be restricted in any way about what doctor they can see or not see. All they have to do nationwide is find a Medicare doctor, and their supplement's going to pay in second position. They still have to pay their Medicare Part B premium. So they've also got 3 amounts of money that they're contributing towards Medicare. The Part B premium, the supplement premium, and the Part D premium. So it's a much bigger expense monthly than a Medicare Advantage plan. In a lot of cases, there are people that cannot afford a supplement and a Part D. So they tend to gravitate towards the Medicare Advantage plans, which are either no cost or low cost.
All right, that's very thorough. Thank you. And I promised that we were going to go into the prescription drugs deeper. And so let's go back to Elisa. And we're talking about Part D now. How does anyone get drug coverage? And how do I know if those drugs that I need, the prescriptions I need, how do I know if they're covered?
Okay, so again, if we're talking about a Medicare Advantage plan, most of those plans already offer a Part D, so it's included in that Part C plan. So a Medicare Advantage or a Part C plan is going to include Part A, Part B, and Part D. That's the prescription component of it. If you're going with a supplement, which is what Jane just thoroughly went over, then you have to go out to the marketplace, if you will, to get a Part D plan. And the way to find out if your prescriptions are covered is you would simply go on our formulary. So Excellus has a formulary online. You would simply look up your prescription medicines, and then it'll tell you what tier your prescription medicine falls in. Depending on what tier it is, it could have, a deductible to meet first, or it could not have a deductible or not even a copayment. So it all depends on which tier your drug falls in. But very easy. If you have a Medicare Advantage plan, the Part D is already in there on most plans. But if you have a supplement plan, you have to get a standalone plan through the marketplace.
Okay, so let's continue with Medicare Part D, because we know how important it is to have. But there are perhaps some instances where someone might not need drug coverage. So let's go to Jane and kind of talk about that, so that if you don't need Part D, you'll know what to do.
Okay, so first of all, the government has decided that if you don't have a Part D when you turn 65, and later on you get a Part D, they're going to penalize you for all the months you went without Part D coverage. And that's a lifetime penalty. So I have lots of clients who come to me and say, I'm not taking any prescription drugs. I don't need a Part D. I'll wait. And I say, no, you won't. It's not worth it, not worth the penalty that's going to accumulate. So the main group of people who don't need a Part D are veterans who qualify to get their prescriptions from the Veterans Administration. And they know who they are. The government says that drugs that are gotten from the VA are what we call creditable coverage. So VA drugs are creditable coverage. So in other words, if a vet down the road decides to get a private Part D plan, he won't be penalized for all the years he only had a VA Part D plan. Truly, that's the only group that I can think of who, there may be a couple of levels of federal employees who have drug coverage that might be creditable. People that are working, still actively employed and have an employer group plan don't need a Part D. They won't have the penalty that I spoke of. But the vets are definitely the biggest group who can get a Medicare Advantage plan without drug coverage included and get away with it. The rest of us don't get away with it.
All right, I think that's pretty clear. Actually, we just had a question come in, and this is just on the basic issue, not just about Part D, but if you are 65 and still working with coverage, do you still sign up for Part A?
I think that's a question down the road, and I think it's my question, but
Okay.
Do you want me to answer it now?
It's coming into our chat, so people are very much interested about that.
Okay, and if I'm stepping on Elisa or Dr. Garg's toes, no. So there's all kinds of cautions around this answer. First of all, if you're still working, actively working past 65, and you're with an employer who has more than 20 employees, You can stay on your employer plan happily if that's what you want to do without any penalties whatsoever. If they have less than 20 employees, Medicare will become the primary insurance, whether they like it or not. And therefore, they should go on Medicare, because now the employer plan is going to say, we're not your primary insurance and we're not picking up the vast majority of your bill.
Mhm.
So
And that's at 65, right?
Correct.
At age 65.
Correct. So the part A is the tricky part, because many people have a health savings account. If they have a health savings account and want to continue contributing to the health savings account, they cannot sign up for any part of Medicare, A, B, D, nothing, because they would be audited and penalized by the IRS for doing so. So some people that are working, yes, you're not in a high deductible plan with a health savings account, go ahead and sign up for A. It's free. It kind of supplements your employer coverage. But if you've got a health savings account, avoid any part of Medicare until you're ready to stop with that HSA.
All right. Thank you, Jane. Dr. Garg, let's talk about the Inflation Reduction Act. It's been all over the news lately. How is this new legislation impacting Medicare drug coverage?
I'm just so glad that we're talking about, drug coverage. And, of course, it's a huge bill. So I'll try my best to keep it focused on things which actually matter to our listeners. Let's just talk a little bit about why this bill was passed. And some of the statistics show that even though you might have insurance, you might have, Part D, there were still, about 5 million Medicare members who were not able to afford their prescriptions. So, and they know who they are. So this bill was aimed at, really closing that gap. Now, this bill goes into effect in layers, essentially, it's a 8-year process. So in 2022, for example, the drug manufacturers will be required to pay rebates to Medicare for Part D drugs, which is essentially saying that Medicare is going to be able to negotiate and not negotiate, but the rebates right now are going to help Medicare reduce their own expenses, if that makes sense. And the eventual hope is that those expenses, when they're reduced for CMS, they're going to pass those savings along to the Medicare enrollees. Now, there were about 1,200 or so drugs, just last year, which had gone up in price. And they go up in price much more than, inflation. So another piece of the act is that, manufacturers will be required to actually, pay this money back if the increase in price is more than inflation, if that makes sense. And believe it or not, the average, price by the percentage by which these drug prices were rising were to the, effect of like 30%. So that's going to be a saving. Now, starting in 2023, January 1st, 2023, insulin is going to be capped at $1.35 per month supply. So $1.35 or less. And it would not, be counted towards a deductible. So it's going to be $35 or less. Nothing else is going to apply to your initial, spend. So that's going to be huge. But also what is going to be interesting is there's going to be no cost sharing for vaccines. So, you're right now, there are only like a couple of vaccines which are covered, but, going into 2023, vaccines like Shingrix or, some of the other vaccines which you still have to pay copay out of pocket, they'll be completely covered. Another thing is going to be lower co-insurance for your infusion medications, which is what we call like Part B medications. And then also in 2023, they'll start negotiating drug prices with the manufacturers. In 2024, there's going to be premium stabilization. What that means is, we heard about Part D has a premium that you have to pay. What government has done through this act is they're going to cap this premium to not raise more than 6%. In 2025, another part of the act goes into play where the out-of-pocket maximum for medications is going to be $2,000. So no matter what, that's going to be your out-of-pocket max. So it takes that uncertainty out of the equation. And then from 2026 onwards, 27, 28, 29, there are like several other drugs which will be added to that negotiated drug list. So starting from 2023, if there are like 10 drugs, then they're going to have like, 15 more drugs that they can negotiate. Then in 25, there will be like 20 more drugs that they will be able to negotiate. So Medicare, when they're able to negotiate directly with the manufacturer, they're going to be, hopefully there are savings enough that going to be passed on to the Medicare enrollees. So that's in a nutshell what it is. I've missed like some technical parts of it, but that's the best that I could do.
Yeah, well, that's going to affect a lot of people. And so thank you for sharing that information. Let's go to Jane now. Jane, can you explain the difference between an HMO plan and a PPO plan? Who would benefit most from each type of those plans?
Sure. And before I differentiate, I want to say, no matter what Medicare Advantage plan type a person chooses, an HMO, a PPO, and there are some other types, all of them cover a person in an emergency situation. So if they're traveling anywhere in the United States and they have an emergency, they go to an emergency room, a hospital, they're going to be covered and they're going to pay their in-network copay. They may have to come back to town and get reimbursed because the hospital in Colorado may not know what insurance they have and how much they're going to get paid. But eventually they will only owe the in-network copay. So emergencies, and Excellus also covers urgently needed care anywhere in the United States, no matter what type, HMO, PPO, everybody's covered. So a lot of times people think they need a PPO if they travel. They don't. Not if they're going on vacation for a couple weeks here and there because of the emergency coverage. The people who really seriously look at PPO plans, usually for me, it's my couples that have a second home in another state and they go to, let's use Florida, the typical example. They're there 3 to 6 months of the year. They've established a second set of doctors in Florida, and it's much more easy on their mind knowing they have PPO coverage, which means in and out of network coverage. So they can see any doctor they want to see, not in an emergency now, we're talking routine care. They can feel comfortable about going in or out of network, and they will have a little bit more to pay out of network, but they'll be covered. That same couple with the home in Florida, they're on an HMO plan. There's no out of network coverage in Florida. So if they're down there and they want to see a doctor and it's not an emergency, they're out of luck. They're going to pay 100% out of their pocket if they're on an HMO plan. Keeping in mind, the emergency is always covered. I'm talking about electively wanting to see somebody when you're in another state, typically. So PPO means in and out of network. HMO means in network only. I'm very happy that Excellus now offers a PPO plan in Rochester. They haven't in the past. We have one this year, and it's got people very excited to see a PPO plan. And what happens is people in that plan can see Blue Cross Blue Shield providers nationwide. It's called the Blue Card Network. And those providers are all in network, no matter what state. But because it's a PPO, they also have the freedom to go out of network nationwide and know that they will be covered. Not quite as well as in network, but better than the HMO where they end up with no coverage.
Well, we do know that people love to travel, so that's good information, Jane. And let's go to Elisa again, because we were just talking about couples. Do spouses have to have the same coverage when we're talking about Medicare?
No, not at all. So as I, meet with people one-on-one, everybody's needs are different. So couples can choose, different plans. All of the Medicare Advantage plans are individual plans. So that means that spouses can have different plans. They can have the same plans, but they do not have to have the same plan.
Okay, and we just got a question, and we were talking about HMO and PPO with Jane. So Jane, they're asking, what about an HMO POS? Do you want to take care of that right now?
Yeah, that's one of the, remember I said there's other types. POS stands for point of service. So you've got the HMO that normally has no out-of-network coverage. The POS portion allows them to see out-of-network providers, but on a very limited basis. So in the case of Excellus, their Value Plus plan has a POS. You get $3,000 to spend out-of-network. So that works great. Let's say you were told you have brain cancer and you want to go get a second opinion in Boston, and you're going to go see a brain surgeon in Boston, and he wants $500 for an office visit. You're going to have coverage on the POS plan, pay 30% to see him. So 30% of $500 is $150 is what it'll cost you to see him. You've just used up $150 of the $3,000 out-of-network benefit. So you've got limited out-of-network. I always say to people, could you have a surgery out-of-network for $3,000? No way, because surgeries are much too expensive, and the POS benefit is on specific things only, and it isn't even including surgeries. So
All right.
A little bit of out-of-network.
All right. Well, thank you for clearing that up for our viewer who asked that. So we are halfway through our seminar right now, but let's go to our next section, because we're going to be focusing on how to get started with Medicare. And we're going to continue with Jane. How to get started? Like, how long do you have to sign up?
Okay, you have 7 months, 3 months before your 65th birthday, the month of your 65th, and the 3 months after. That's your initial enrollment period. We call it IEP. Any time in the 7 months is fine. Social Security is slow. So I tell people, you want to, if you're not already collecting Social Security when you turn 65, start that 3rd month before your birthday month so that you have your card on time. They've become slower since the pandemic hit than they were before it. It takes them sometimes 6 to 10 weeks to issue a Medicare card. Why? We don't know, but it takes a long time. So the quickest, fastest way is to sign up online. You do that at medicare.gov, G-O-V. You can also go to the Social Security website and sign up, because Social Security is Medicare in essence. Medicare.gov is a little cleaner. Sometimes people get confused when they go to Social Security. Do I want to sign up for retirement? Don't I? Many people don't. So you do not have to get retirement and Medicare at the same time. Doesn't have to happen. Don't get confused and sign up for what you don't want.
Okay.
Any other way they do it is just much slower. So I highly recommend signing up online.
All right. Well, and we're talking about Medicare right now. So Elisa, do I have to sign up for Medicare? I mean, will I get penalized if I don't or if I wait?
So group size really determines if you have to sign up for Medicare. So I know Jane touched upon that a little earlier in the presentation here. But again, if you work for a company that has less than 20 employees, Medicare rules state that you must sign up for Medicare A and B when you're first eligible to avoid that penalty. If your group size is over 20, then we should probably meet one-on-one and have a discussion whether your employer's plan is more than that Part B premium. Sometimes it's cheaper to go on Medicare. You could continue to work past 65 if you wanted to, but you would just come off of the group insurance, go on Medicare, and pick a Medicare Advantage plan. Sometimes that makes financial sense. Also, if you are on a marketplace plan, through something on your own, that plan is not considered creditable. So you would want to enroll in Medicare A and B when you're first eligible. So there are, many different circumstances. So meeting with someone like myself or Jane, we could really point you in the right direction and make sure that you're making a decision that makes financial sense to do so.
All right, Elisa, I'm going to continue with you on this question. Once you've signed up for Medicare, can you change the plan you're on, or how often can that happen?
Yes. Yep. There are many opportunities to change your plan. Right now is a perfect opportunity to review your plan options. We are in the annual enrollment period. It goes from October 15th through December 7th of each year. So that's your opportunity to change your plan. There are other opportunities throughout the year, such as a special enrollment period. If you move in or out of the area, that would be an example of a special enrollment period that will allow you to make a change. If you're retiring in the middle of the year, that's a special opportunity to change your plan. Having Epic is another one. So there's many, many opportunities. And then there's also one that runs from January 1st through March 31st. That's the Medicare open enrollment period. There, again, is another opportunity to change your plan. So I always tell people you're never locked in forever. There's plenty of opportunities to change your plan should you need to in the middle of the year.
All right, thanks, Elisa. Dr. Garg, I know this is on a lot of people's mind. Can you be denied Medicare for any reason? Like, for example, if you have a pre-existing health condition and a lot of people are worried about their income qualifications, the levels of income. So could you talk about that, please?
Sure. Specifically, like for pre-existing conditions, Rebecca, you cannot be denied Medicare. But there are eligibility criterias which are out there for Medicare, and those eligibility criterias have to be met. And if I have to just go over them quickly, as long as you're more than 65 and you're eligible for Social Security, which means that you're qualified American citizen, or you have been on some sort of like a green card for at least 5 years. So that's eligibility number one. Regardless of age, if you have ALS, which is a terrifying disease, also known as Lou Gehrig's disease, you automatically qualify for Medicare. Another condition which will qualify you regardless of age is having end-stage renal disease. So if you have kidney disease and you're on dialysis, you automatically qualify for Medicare. And the fourth group is if you are on disability, and you've been getting disability for at least 2 years. So if you're disabled and you're receiving disability benefit for at least 2 years, regardless of age, you will be eligible for Medicare. So those are the criterias.
Should we talk about income qualifications?
There is no income qualification that I'm aware of that you need to be. In fact, like, if your income is below a certain percentage, you might be eligible for more benefits. There are, some plans called, there's some Medicare plans called dual plans, which, it got to qualify, of course, for these plans if you're below a certain income level. But you can essentially get a lot more assistance with your co-pays, with your prescription drug co-pays and your co-insurances and all that. So those are different plans, but for Medicare Advantage or for traditional Medicare, there's no income qualification per se.
Well, I know a lot of people say, oh my gosh, everything is so expensive. So let's go on that, because I heard Elisa mention Epic as well. But let's ask Jane to go over some of the programs that do help offset healthcare and drug costs. So Jane, do you want to take that? We have that graphic up now.
Sure. And these are all income related. So the highest level of help that somebody can get for drug costs is extra help from the federal government. And every year the exact income levels change. Right now we're waiting for them to tell us what those will be for 2023. So we're still operating on 2022 levels. But it is truly low income for either an individual or a couple. You qualify through Social Security. As a matter of fact, Social Security sends out the application to everybody when they send out the Medicare card. So everybody is made aware that they can apply for this help with their drugs. The Medicare Savings Program is help for paying the Part B premium. So I think Dr. Garg mentioned it's $164.90 for 2023. So there are people, again, depending on the income, who get all of it paid for or a part of it paid for. So that's a big help to not have that withheld from the Social Security check. And then the easiest thing to qualify for is the New York State EPIC program. We always kind of laugh and say our lawmakers must have had a good cocktail party when they made these rules, because they're better than any other state in the nation. You can qualify for EPIC if you are single and make below $75,000 a year, and married and make below $100,000 a year. So those are very generous income guidelines. I encourage all of my clients who will qualify to become a member of EPIC. Number one, you never know when you're going to be put on an expensive drug that EPIC could help you pay for. And number two, Elisa mentioned that being an EPIC member gives you the right to change your plan once a year, anytime you might need to change your plan. So EPIC is a great program and everybody should belong to it who can.
All right, thanks, Jane. We're in our final section now. We want to remind everybody, the viewers, you can ask questions in the chat, and we will try to address those at the end of our presentation. But let's go over and review, why we should review coverage annually. So let's start with Elisa. You've already mentioned that people have lots of different times where they can assess their coverage or change, but why do we hear a lot more about Medicare at this time of year than any other time of year?
Well, that is because this is the annual enrollment period. So again, it runs from October 15th and it ends on December 7th. So, this is a great time to review your current policy. Take a look at your, your needs, your medical needs, see if something's changing in the future. Did you recently become a snowbird and now you may need a PPO plan? Do you need more medical services? So again, this is a great time of year to review and take a look and see if maybe there's another plan out there that might be a good fit. If you're with another carrier, you can change within that carrier. You could jump carriers during this time. So again, it's just an opportunity to make changes, and that's why you're seeing all the commercials and the billboards and everything else out there, just to remind people that this is the time to do it.
All right, thank you, Elisa. And let's continue that with Dr. Garg, because you would encourage people to review their coverage annually for other reasons, perhaps even drug changes, network changes. What else can you advise?
So just to add to what Elisa mentioned, as a physician, as a practicing physician who's, still seeing patients half a day, I do medication review every time my patient comes in. And that's because, things change, in a course of a year. The situation change, your disease state change, your medication requirement change. Sometimes your medications need to be changed, or, there might be something new in the market, which might be more appropriate for you. So, applying the same logic, and also, as Jane mentioned, Excellus invested heavily in bringing out like some new plans, locally, not just, in Rochester, but the entire upstate region. And, we added things like, Flex Card. We added, dental coverage, $1,000 with no questions asked, pretty much. We added transportation benefits. We added, bunch of other like little things which you're actually going to use. So maybe, some of these things that are being offered by us or some of those other plans may be of interest to you. And I mean, I think like, it's just, being on top of everything, and, reviewing, it just doesn't, take anything out of your pocket. And as the competition, is growing in our region, we're getting a lot, you're getting a lot more bang for your buck. So if you're not reviewing these plans with your broker or with your trusted, partner, then I think you're leaving money on the table. And during this time of like, high inflation, you don't want to, leave any money on the table.
I agree, and I'm sure many people watching tonight agree as well. Jane, we just had a question from Maria, and this is perfect because she asked, are those commercials legit? Should we be listening to them? How do we cut through the noise of all these things? There's a lot of information out there, and we're so happy you can provide us with the real good stuff tonight. So why don't you give us any tips that you can to know how to get through the noise?
Okay, so I want to start by saying, if I had Joe Namath in the room with me, I'd punch him in the nose. I'm so sick of his commercial. So let me tell you about those commercials. Those are celebrities hired by large call centers to do their Medicare commercial pitching for them. When you respond and call their 800 number, you're very likely talking to an agent in another state who does not know the Rochester area at all. They very seldom take the time to look up your doctors or your drugs. All they do when you say to them, I want this benefit that you just mentioned in the commercial, they look up the plan that might have the benefit that you said you want. It may not have your doctors in their network. It may not have your drugs in the formulary, but all that call center agent does is say, I found the perfect plan for you. It has just what you want in it. And they sign you up Only a month later, you find out when you go to your doctor says, we don't take that plan. And now you're stuck. So I highly encourage everybody to work with a local expert, not a call center person in whatever state they may be working from. No, nobody gets free. It doesn't exist. Plans have some things and not other things. People that have Medicare and Medicaid are the only people who get most things for free. The vast majority of seniors cannot get all those things for free. There's no such thing as getting 100% of Part B back in your Social Security check unless you're on the Medicare Savings Program due to low income. So, and when you get a piece of mail and you write your name and phone number and send that postcard back, you've now just given them permission to call you for the next 90 days.
And they don't give up.
They do not. They do not. So caution, red flags, bells, whistles, don't do it. Talk to somebody here who's going to take the time to guide you and help you the right way.
All right, Jane, thank you. And we should let everybody know watching right now that at the end of the presentation, we're going to give the information of local people that you can touch base with, including our experts that are talking tonight. So Maria, just hang on. We only have a couple more questions and we will review that information. But let's go to Alyssa, because a lot of people want to know about the new plans and benefits. We're talking about them tonight for 2023. What are people most excited about? What are they really looking for?
Well, in my experience in meeting with people, you know, in the last few weeks here of the AEP, I would say people are extremely excited about the new dental that we've added. So everybody gets dental no matter which plan they enroll in with us. That's going to be preventative dental, as well as an extra $1,000 of comprehensive dental. So again, people are very excited about that. Also, the PPO. We haven't had the PPO in years. So we brought the PPO back and it's been extremely popular. You know, we're giving a $500 flex card benefit with that PPO plan. So people are really excited about that. We've added lots of new things, you know, transportation benefit on some plans, mom's meals. It's a meal service where if, you know, you're an inpatient or in an observation stay or skilled nursing facility, some of the plans will offer a meal program, an over-the-counter benefit. We've added that on all of our plans. You get at least $120 of over-the-counter every year. So those are just some of the very exciting new features to look forward to in 2023.
Elisa, could you tell us what is the Flex Card?
Yes, so the Flex Card is an exclusive benefit to our new PPO, $19 PPO plan. And the Flex Card comes preloaded January 1st with $500 that you can use towards any dental, hearing, or vision expenses. It does not roll over from year to year, so it is a use it or lose it deal. But, you know, potentially somebody could have $1,500 to use on dental instead of just $1,000. So again, it's going to be extremely popular for 2023.
Yeah, I can imagine a lot of people are excited about that. Let's go to Dr. Garg. You know, a lot of thought and research goes into developing these products because you want to give the people what they need. What trends are you noticing the most for 2023 with your patients?
Rebecca, great question again. So, you know, there are some new trends and there are some things that don't change. So let me start with the things that don't change, which is, you know, people don't want to change their physician. They want to change their doctor or specialist that they've gotten used to for the last several years. So that hasn't changed, but some of the new things that people are looking for is what we, you know, try to add. in our benefits at Excellus, which is, the flex card, where you can use it for, as Elisa explained, any kind of, benefit, medical spend. That dental coverage. I mean, you may be a healthy, 60-80-year-old who may not require as much of prescription, but you're going to definitely go and see your dentist and get that root canal done. And as she mentioned, you're going to have $1,500 to pay towards that comprehensive dental. Same thing goes with like some of the vision benefits that we have added, like you have, couple $100 depending on like which plan you choose, which you can use towards your prescription glasses. All of these things are not something that traditional Medicare provides. Some of the more interesting options are like the buyback. So we've added an option where you can actually get the money back in your Social Security. The Part B premium is going to be less because we are going to add that money back. So those are all things that research showed that people were looking for, and there's a lot of like effort that goes into creating these new plans, and our team has worked really hard, and we are very excited about what we are going to be able to what we are offering and helping the community.
Yeah, and I honor the fact that Excellus Blue Cross Blue Shield has focused on the Rochester area, and just the same, Jane, she runs her business here in the Rochester area. So Jane, why don't we wrap things up with trends that you're noticing, because you're out there giving seminars and Medicare 101 programs all the time. What are people talking to you about the most?
The excitement over the Excellus plans. Two things. The plan that Dr. Garg just mentioned with the $27 give back into the Social Security check. So that $164.90 for Part B minus $27 becomes $137.90. So that's what they're having taken out of Social Security for Part B. So it's less. So we've been celebrating with our clients so they can have $27 back from Excellus, and they're getting an 8.7% Social Security increase. So they're going to have all this money next year that they didn't have before. So that's been great. And the other thing which everybody's mentioned is the dental. And it hasn't been mentioned, so I'll mention it. The exciting thing is that when you say Excellus is offering free dental, probably 80% of the dentists in Monroe County and surrounding counties are Excellus in-network dentists. If you go to a dentist's office and say, what insurance do you take? Excellus is always one of them, or the majority. So people are excited because they know their dentist will take this insurance, so they will get the full benefit. Cleanings, x-rays, and exams will really cost them nothing out of pocket. The $1,000 towards big stuff will really be $1,000 towards big stuff. It's so different when it's an in-network dentist compared to an out-of-network dentist. So I'm not a big fan of dental, never have been, but now that it's Excellus Dental, it's exciting because it means something.
That's great. And I know a lot of people will be happy to use that benefit. And I know we've presented a lot of information here tonight, but that's what this webinar has been all about the Rochester area, with Rochester experts giving you information that you can use and then access them with the information you're seeing on your screen. This is how you can contact them. Elisa, you see her email and her phone number, Jane as well in the middle, and then Dr. Garg is ready to assist by giving us information and conducting more of these webinars in the future. So we're so grateful to have all these wonderful experts available to us, and you can access them even beyond tonight's webinar. We appreciate all the people who asked questions in the chat, and I know that Ryan was answering some of you specifically to your situation, and we were able to get some of the questions answered live here on our webinar. But I do thank everyone for joining us tonight. Elisa Brescia, Jane Ahrens, and Dr. Ankit Garg. Thank you so much, and thank you for joining us for our webinar presented by Excellus Blue Cross Blue Shield, a guide to Medicare. And be on the lookout for a link in a thank you email. It will be coming to you from the Buffalo News in the coming days. Lots of great information shared today, and we thank you for joining us. Have a great night.
Thank you, Rebecca. Thank you, everyone.
Thank you.
Thank you.
Thank you, everyone.